And we're a really unique partnership with Emory and Georgia Tech that aims to provide people with mild cognitive impairment and their families and their care partners an opportunity to participate and to get educated about lifestyle programs that promote joy, purpose, health, and wellness after that diagnosis of MCI. The doctors, Dr. Law, Dr. Levy at the Emory Neurology Clinic, they were giving out diagnoses and noticing that they'd say, okay, change your diet, get more active, and get social. And the next year, we'll see you later. So really, the cognitive empowerment program was put together as an answer to that. Like, how do we do that? What are the best ways to connect socially, to be more physically involved, to get some small workouts that are accessible for our bodies in, and to also be able to connect with things like support groups, education sessions, nutrition sessions. So we're really aiming at this mission to empower people with mild cognitive impairment and their families in this living lab where we can really study what are the effects of these lifestyle programs, how do they impact you, especially because, as you may know, the pharmaceutical options for being able to take a pill and have things solved with mild cognitive impairment or early stage dementia are very limited. So our vision really is to revolutionize the experience of people affected by MCI and create a comprehensive approach, a comprehensive program, and the right research that can be replicated nationally and internationally. So along with that, this week we're talking about social engagement and loneliness in MCI. And Jasmine's going to get into it a little bit to explain, what that means, what social engagement, what loneliness really means, and how they can be risk factors and the health outcomes that are related to loneliness and engagement for older adults. She's going to talk a little bit about how the impact of people with MCI that participate in social interactions, how that can really kind of change your experience of having MCI. So we'll get into that in a moment. She's also going to provide us with some reading resources related to social engagement and loneliness. But before we do, it's good to have you with us, Jasmine. We talk about having experts on the team. She really is. She's a sixth-year doctoral student in clinical psychology at the University of Massachusetts Amherst and a pre-doctoral intern at Emory University School of Medicine in our adult and geriatric neuropsychology track. Her research include interest about ethical and racial disparities in cognitive aging, so much, so needed, about Alzheimer's disease and related dementias. And what her interests really are, and she'll tell you a little bit more about this, are the psychosocial and contextual factors that affect cognitive aging. And so she'll get into that and break it down a little bit, but especially for historically marginalized populations, which we find are so much less represented in research. Her clinical interests are really in aging, mild cognitive impairment, Alzheimer's disease, and related dementias. I'm sure that I know we're really proud of her. I'm sure she is excited about this fall to start her postdoctoral fellowship as part of the Harvard Partners Consortium for Clinical Neuropsychology and continue her research and clinical work focused on aging and Alzheimer's disease. So I'm so excited. It looks like Casey's here with us as well. So I'm going to go ahead and let you kick it off, Jasmine, and really tell us about what brought you into this work a little bit, maybe, and how this became a topic that you've been interested in your journey in neuropsychology.
Sure. So I've always had an interest kind of in aging and Alzheimer's disease. And I guess I've always really been interested in risk factors and like what makes people sets people on kind of this pathway of having Alzheimer's or other dementias versus other people who kind of go through normal aging. So I'm really interested in what are the risk factors, but also what are some of the protective factors too. There are some things that people can be doing. Sorry, the bell's going off. What are some things people can be doing, like social engagement, that can be protective for their brain and for their cognitive health? So that's kind of my little area of interest, research wise, as well as clinical. Yeah. So if it's okay, I'll just kind of get started. So the talk for today, again, is about social engagement and loneliness in MCI. Just to kind of give you some overview or kind of what we will be talking about today. So first, I want to kind of talk about what are these concepts? What is social isolation? What do I mean when I say social engagement, as well as loneliness? What do these kind of big concepts mean? I also want to talk about risk factors. What makes people kind of at risk for loneliness, as well as the health outcomes. There are many health outcomes that are linked with loneliness, and I wanted to talk about that a little bit. I also want to talk about the changes, the social and emotional changes that occur in MCI, and what does that mean for our social engagement. And then I also want to give tips for people who want to be engaged more socially, some ideas about how to get started. And then I'll end with some resources that people can use to kind of get started as well. So, first, I want to talk about these kind of big concepts. So, social engagement and loneliness, and some other topics as well that are concepts as well that are related. So, first, I want to talk about social engagement. What is it? So, social engagement involves a couple different things. So, the first thing is social network size. So, how many people are you in your day to day interactions, having day to day interactions with? The social activities. So, what kind of activities are you involved with day to day? And then social support. Much support, whether it's emotional support, people that you can talk to when you're having a bad day, or instrumental support, which just means that people are helping you out, taking you to doctor's appointments, things like that. How much support are you receiving? Next is social isolation. So, this is actually getting at how big is your social network? So, how many people are you actually interacting with day to day? And social isolation is really getting at that amount of people is getting smaller or it's decreasing. And you're having a reduction in social contacts or relationships. Next is social connectedness. So this is more of a feeling versus something that you can kind of count and point out. So this is a feeling of having close and positive social relationships. And then loneliness. So loneliness is kind of a discrepancy or inconsistency in how the social relationships that you want versus the social relationships that you're actually receiving. So you may want more social relationships than you're actually having your day to day. And that's where people start to feel lonely because they want more contact, but they're not actually getting that in their day to day life. Next, I want to just kind of give you some data about what we know about loneliness among older adults. So, the University of Michigan actually came out with a poll or a survey that they did earlier this year. And they asked a bunch of US older adults between the ages of 50 and 80 years old questions about loneliness and their day to day social interactions. And I want to share some of those results that they found with you. So they found that about 34% of older adults feel isolated from others, like they don't have any connections. 37% felt a lack of companionship in the past year. 33% felt that they had less contact with people outside their home, in that they only saw people either once a week or less than once a week for people outside their home. And 77% of those who rated their mental health as fair or poor also felt isolated. And there are some gender differences that researchers are starting to figure out and examine. And so we find, at least in this survey, that 37% of women felt socially isolated versus 31% of men. And the researchers looked at the difference between pre COVID-19, looked at the numbers during COVID-19, and then now in 2023. And so they saw that the amount of loneliness that older adults were reporting decreased since the start of the pandemic in 2020, closer to the pre-pandemic numbers, but they're still pretty high. And as you can see, at least a third of older adults are reporting some type of social isolation or loneliness, which is pretty high. So it's very common for older adults to kind of experience this. And so, what we also know are there are racial and ethnic differences, group differences in experiences of loneliness and social isolation. So, research tells us that among white older adults, they're more likely to live alone, are childless, or don't have any children, and have limited contact with their religious congregation members compared to Black older adults. For Black older adults, some protective factors are being female or identifying as female, as well as living in the South. So, research for those who are Latinx or identify as Latinx is still kind of a area that needs to be researched definitely more. But the research that we do know, it's not quite clear if there are differences between those who identify as Latinx versus non-Latinx white older adults. Some research finds that there are ethnic group differences, and some research finds that there aren't any differences. So, social network changes across the lifespan. That just happens with everyone. So, as we go through our life, we're exposed to different people at different settings and through different activities. So, social network means a network of social interactions and personal relationships. And as you can see from the figure, there are many different ways that we can interact with other people. So the first social network that we have is with our family, our immediate family, as well as extended family. Then we kind of branch out a little bit to our wider community or neighborhood. As we start school, we have our friends at school, our teachers, then our friend group kind of gets bigger. And then as we grow older and go into the workforce, there's another network that we're connected with as well. And so, what we do know is that these family social connections, so that first social network that we're exposed to, remains stable over time. It remains stable across the lifespan or across as we age. But we know that these extended social networks, so thinking about school, work, other activities, they decrease as we age. And it can be for a variety of reasons. One reason I can think off the top of my head is retirement, which is common with older adults. You're not exposed to meeting as many new people because you're not working. You're not involved in day-to-day activities in the same way as you were when you were younger. So next, I want to highlight some health outcomes that we know are connected with loneliness. So there are a lot of health outcomes that we know are associated with loneliness. So loneliness in itself is a distressing experience, but it also leads to other distressing health outcomes as well. So some health outcomes that we know are high blood pressure, heart disease, obesity, a weakened immune system, anxiety, depression, cognitive decline, dementia, as well as poor sleep quality. We also know there are several risk factors for loneliness. And I got this information from the National Institute on Aging, and I'll put a link, there's a link for this at the end of the presentation as well. They provide a lot of great information. But some risk factors that they noted are for people who live alone. So you're not exposed to people naturally day to day. You will have to go outside of your home to actually connect with people. Those who can't leave their home for a variety of reasons. One reason I can think of is that individuals who have mobility issues or have difficulties walking and being transported to different places. Those who have limited social support, those who have trouble hearing, um, any language barriers. So someone who doesn't speak, if since we're in who doesn't speak the primary language of the place that they're at, could be a language barrier for them to experience loneliness. Those who experience discrimination due to a marginalized identity, those who have cognitive challenges, and those that are not engaged in meaningful activities. And so what I want to highlight for the rest of this presentation are these last two. Those who are experiencing cognitive challenges, such as MCI, and those that are not engaged in meaningful activities, and how we can provide tips for engaging in meaningful activities. So I know this may be review, but I just want to again provide the definition or what we think of when we say mild cognitive impairment. So mild cognitive impairment is an early stage of cognitive ability loss in which people still have the ability to independently perform their daily activities. So it's not normal aging and it's not quite dementia. It's kind of that in between kind of stage. And so, if you've been diagnosed with mild cognitive impairment, you may have did a sort of evaluation, paper and pencil testing, that kind of got a sense of what your memory and thinking skills were at that time. And so, when we're doing these types of evaluations, we look at several different areas, particularly with cognitive domains or skills. We're looking at these 5 areas. So the first is executive function, which is a very fancy term that basically means that we're looking at your skills in planning, organizing, and strategizing. So those are the main things that we're thinking about when we say executive function. Next, we're looking at memory. So this is for both verbal information as well as visual information. Visual spatial, it's another one of those fancy terms. So basically what we're looking at is your ability to kind of judge distances between, say, yourself and objects. So for instance, if you're walking into the room, can you judge your distance from, say, a chair so you don't knock into it, or say the wall so you don't run into it? It can also be, another example is when you're driving. Can you judge how far your car is away from other cars as well as from the curb? We're also testing attention and your ability to pay attention and concentrate and focus. And then we're also looking at your language skills. So we're looking at it mainly in two ways. So are you able to say what you want to say? So are the words that you want to say, are you able to say them? And then we're also testing whether you can understand what other people are saying. So there are many reasons that someone may be diagnosed with mild cognitive impairment. And so everyone's very different. And so I wanted just to list some reasons that people may be diagnosed with mild cognitive impairment. So for instance, I guess the most common would be Alzheimer's disease. There's also Lewy body dementia, vascular dementia, Parkinson's disease, traumatic brain injury, frontotemporal dementia, alcohol dementia, as well as mood disturbance. And so, with all these different causes, it can affect different parts of your brain as well as your different skills that we just talked about. And everyone is not affected in the same way or to the same degree. So, next, I want to talk about some social and emotional changes that occur in MCI that can impact your ability to engage in successful social interactions with others. So we're social creatures as human beings. So we need human interactions. We need interactions with others. Some people need more or less than others, but we kind of all need some sort of social interaction with people. And so when we think about social interactions, it requires us to use certain different skills. So, for instance, when you're having a conversation with someone, you need to remember the topic of the conversation. So, your ability to remember what the other person just said or what you just said as well. It requires you to pay attention and to stay focused. It requires you to adapt or change to other people's perspectives because we're all different. We have our own ideas about things, and we need to be able to kind of shift or change based on other people's opinions. It requires us to understand other people's expectations, their thinking, and their emotions. We need to be able to read those or understand other people. And it also requires us to control the urge to do irrelevant or inappropriate behaviors. And so, persons with MCI can have difficulties in social interactions for a variety of reasons. So you can have difficulty in identifying social cues. So for instance, if you are having a conversation with someone, maybe you don't realize someone else is still talking, you start to talk over them. So you're not really paying attention to the back and forth of the conversation to kind of have that smooth kind of conversation that people typically have. People with MCI may have a decrease or reduction in their confidence to interact with others. You may not feel like this is something that you're able to do. And that in itself is distressing. So, two problems or cognitive problems that people typically have that makes social interactions very distressing or an anxiety-provoking situation for people with MCI is if they have memory problems, and then if they have trouble saying the words that they want to say. And though, so experiences or feelings of loneliness and social isolation can occur. And because these things occur, these feelings of loneliness occur, people with MCI can tend to engage with other people less because it becomes an awkward and anxious kind of situation for them, which is understandable. So, I want to talk about some research that just came out recently that actually compared social interactions, daily social interactions between those who have MCI versus those who do not have MCI. And so researchers found that when they compared those without MCI with those who did have MCI, those with MCI reported less frequency of having any social interaction at all. They experienced less positive or pleasant social interactions. So the social interactions that they did have, they weren't a pleasant experience for them. And then also less daily in person socializing. So they saw people in person less and less compared to those without MCI. And the takeaway message from this is overall, those with MCI are experiencing less quantity or less frequency of social interactions, as well as the quality. So these social interactions and these social relationships that they're having are not pleasant. And so next I want to talk about neuropsychiatric symptoms, which is a very fancy term, which basically just refers to the emotional and behavior changes that occur for people who are diagnosed with MCI. And there are a lot of different symptoms that come up for people. And this is a very common experience. So, research shows that between 35 to 85% of individuals with MCI will experience neuropsychiatric symptoms or some type of neuropsychiatric symptoms. And so the symptoms I want to highlight are the emotional ones in this piece. Again, there are many different symptoms, a lot of behavior symptoms, but for this slide, I want to particularly concentrate on the emotional piece. So, some neuropsychiatric symptoms are that can be distressing in social interactions or can be barriers to social interactions are depression. So this is when people feel very sad or hopeless, and they just don't have, they're just not emotionally able to interact with other people. There's also apathy. So apathy is not depression. So apathy gets at it's difficult for individuals to be motivated and to do activities because they just don't have the motivation. It doesn't mean that they're necessarily sad or feeling some type of hopelessness. It's just that they don't, it's difficult for them to start to do things. And so in those cases, it may be up to other family members or other providers to kind of help them guide them along to do activities. So that's people who are experiencing apathy. Anxiety is another big one that can be a barrier to social interactions. And then, as well as agitation or irritability. So, if you are agitated, you may not want to be around people. So, that's very common. And again, these symptoms can impact the quality of life for patients as well as their family members and interfere with social engagement interactions. And I want to just again review what is social engagement. So, social engagement involves three kind of parts to it. So, we're thinking about social network size. So, again, it's how many people you are in regular contact with. This could be family, friends, or your neighbors. Next, I want to highlight social support. So this can be in different forms. So it can be emotional support. So who can you talk to when you're having a hard time? It can also be what we call instrumental support. So do you have someone that can help you complete tasks, such as taking you to your doctor's appointments, or if you need help around the house, do you have someone to help you with these things? And then there's also social activities. So these are activities that provide a chance to meet other people, to learn something or learn a new skill, and just give you that social interaction that we talked about earlier. And so for the rest of this talk, I want to concentrate on social activities. And so when we're thinking about social engagement, this is a great opportunity to kind of reflect. What is meaningful activity to you? what matters to you as a person who has MCI, which may be different from your care partner, extended family, friends, or what the wider society is telling you is important. And this can be different for each individual person, and it's based on a variety of different things. So it can be based on who you are as a person, your values, your goals, your cultural background, as well as your personality. And these are just some ideas that I got actually from the National Institute on Aging on some social engagement activity ideas. And this is a great opportunity to try some of these things out. So one idea is to restart an old hobby or to take a class to learn something new. You can also schedule a specific time to connect with your family and friends. We live in a very technology heavy age right now, so there are different ways to communicate with people. So you can use old fashioned mail, you can use your phone, in person, Zoom calls, texting, sending letters or cards to people. Another idea is to adopt a pet. I know since the pandemic started, there's been kind of an influx of pets that need to be adopted. So this may be a great opportunity to kind of take up this activity and to give a pet a new home. Staying physically active. So this can be in a group exercise, so you have the chance to meet other new people, or you can plan to exercise with your friends. Also connect with new and old neighbors. So if you've been in your neighborhood a long time, just connecting with your old neighbors or seeing if there are new people arriving in your neighborhood. This is a great chance to kind of meet new people. You can also engage with faith-based organizations. So sometimes people are very involved in their church communities. This is a great opportunity to either be really involved and serve on a committee or just attend different events that your church community is hosting. Also, activities that are held at local senior centers, around your neighborhood, or public library. And then lastly, community outreach or volunteer work. So hopefully the idea is that this is a great opportunity to try something new. I want to highlight if you try something and it doesn't work out, that's okay. You've learned something either way. You've learned that this is an activity that is great for you, or you learned that this is maybe I tried it, it's not really for me. Maybe I can try something else. It's not a failure, it's just an exploration. It's kind of a journey. And these activities that you engage in can change over time. So if you choose to do one activity, you can change to another different activity that best suits you. And the idea is to choose an activity that's challenging, but doesn't cause frustration with you. So there are cognitive benefits to social engagement, and I want to highlight some of the research that's already been done. So we know that more contact frequency with large social networks is associated with slower overall cognitive decline for individuals. So thinking about those social networks and those social networks that are really heavy in friends compared to maybe family members are associated with better memory and language skills for older adults. Those who have greater engagement in social activities are associated with less decline in their memory, their speed of processing information, and spatial skills. And then those who have a lower satisfaction with their social support that they're receiving, meaning that they feel like they're not getting the amount of social support that they would like, it's associated with having greater memory decline. And we know with social engagement, there's some racial group differences as well. A recent study that came out in 2020 actually found that there were no racial group differences between Black and white older adults in the social support that they received or they perceived that they were getting, as well as the social network size, so how many people they were in contact with. But Black older adults in this particular study reported less participation in social activities than white older adults. And in this particular study, they found that social activity participation was associated with better memory, particularly for white older adults. So there are some differences. Next, I want to talk about some tips for those who have MCI and want to choose social activities for themselves. I want to just give you some things to think about when you're thinking about choosing a social activity to engage in. So, the first thing is, what is meaningful activity to you? So, again, this is thinking about and reflecting on what's important to you. And again, this may be different than what your family wants or what your doctors want. Really important for you? Is this activity consistent with your values? Things that you value and you hold as something important to you. What are your goals for this activity? Is it to meet new people? Is it to learn a new skill? Is it to start a new hobby? Would you enjoy this activity? So again, is this something that you enjoy and you want to put your time into spending? And again, this may be something that you try and you realize it's not really for you. That's perfectly fine. At least you tried it and you know either way, this is something for you or not. Or you can give something that you didn't think was a try, something that you would like, and you end up enjoying it. It's all about the process. And lastly, is this a good use of your time and effort? Is this something that you want to spend when you're thinking about your day-to-day activities or your weekly activities? Is this time that you want to spend doing this particular activity? And again, you want to choose an activity that's challenging but not frustrating for you. You don't want to choose an activity that causes you emotional distress or makes you upset. Next, I want to talk to tips for family members that have persons with MCI. So, as family members, there is a role for you in this kind of journey or this exploration of persons with MCI finding their social activities that they want to engage in. So, as family members, try to be patient with the process. It may be a lot of trial and error. They may try an activity and don't like it, or they may try an activity, love it for a long time, and then they kind of want to switch. It's all a process. So please be patient with yourself as well as the person with MCI. Be open to hearing what the person with MCI finds meaningful to them. So, again, what's meaningful to the person with MCI may be different than what you find meaningful. Resist the urge to step in and fix the problem. If you're always a fixer, this may be a difficult time for you to kind of step in, but resist that urge. And also resist the urge to do the activity for the person with MCI. This is about them and them engaging in the activity. Engage in ongoing conversations with the person with MCI and realize that activity interests may change over time. So, you want to have that ongoing conversation about, is this something that they find meaningful? Is this something that they're enjoying? And you want to kind of shift based on their opinion. And they're going to lead you with the social activities where they want to go. And then I want to emphasize allowing the person with MCI to to have independence with these social activities. Let them try it out. It's really important at the MCI phase to maintain as much independence as or feelings of independence as you can. If you can do a skill, if you can do an activity, we encourage you to do it. But um, be available if they need you. So this is a great opportunity for the person with MCI. If they're having trouble, they know that you're there and they can ask you questions or ask your assistance if need be. So you're there, but you're allowing them to do this on their own to use those skills. And so I want to briefly discuss ways to get around challenges that we've talked about. So, we've talked about emotional challenges. So, apathy, so that difficulty being motivated to do things, as well as depression. So, one way to get around this in psychology, we like to say sometimes you have to do the thing, even if you don't want to. So sometimes we just have to do the activity and see if our kind of mood and our feelings about the activity change. Sometimes when we start to do something that we really didn't want to do, by the end, we actually enjoyed the activity. So you just have to get started. Next is functional. So maybe the activity that you choose is very complicated. So ways to get around that are to choose a simpler activity that you can do, or to break down the activity into different steps, smaller steps that are more manageable. And then there's also cognitive difficulties. So common cognitive difficulties are forgetting people's names that you meet in these social activities and engagements, as well as forgetting how to do activities. So a great way to get around this is to write everything down. I can't emphasize that enough. Writing things down, and as well as reviewing your notes daily. So if you forget something, at least you have it written down somewhere that either the person's name, for instance, or the activity, how to, you have a recording of that so you can kind of jump back into the situation. And lastly, I just want to give you some resources. These are national kind of resources. So, the National Institute on Aging has great tips on activities to enjoy as you age, and as well as tips for staying connected to people, as well as more information about what mild cognitive impairment is. The Alzheimer's Association, the National Alzheimer's Association, is a great resource as well. It's kind of misleading to say, sort of, that it's Alzheimer. They strictly do Alzheimer's. They don't. If you have other types of dementias or MCI, and again, we discussed there are many causes for MCI. They have many great resources for those who have MCI on their website. And there's actually a local Georgia chapter that has many great resources for persons with MCI as well as their family members. And then lastly, there was a really great survey that I came across recently by AARP that talks more about loneliness and social connections. And in that survey, they gave a little bit more data about the experiences of loneliness that older adults are experiencing, as well as some tips for engaging in social connections as well. And with that, I have a couple other references if people are interested. But other than that, that is my talk. I'll stop sharing.
So great, Jasmine. And we have a lot of really curious questions that are coming into the Q&A into the chat that I'm going to throw at you. And I know Casey's on the call. Feel free to jump in, Casey. There she is. Hi. um,
Hey, I'm just here for support. Jasmine's got this.
well, one of the questions that came up is, when we're talking about attention
Mhm.
and being attentive in these tasks, especially things like activities, one of the questions is, how does hearing play into some of this, being able to be attentive? Can you just speak just really kind of quickly for John, who's in the chat?
Sure. So I think he may be referring to the hearing as a risk factor a little bit. So if you can't hear what other people are saying, it makes it really difficult to concentrate and to kind of focus and keep up with the conversation or keep up with the activities. So that's why we say hearing in particularly is a risk factor. So ways to kind of get around it. I think it's really important if you have a hearing difficulty to let people know. I know that may be very vulnerable thing to say to people, but I think it's really important. Hopefully you're in a network of people that are supportive and care about you, that you feel comfortable saying, I have hearing difficulty. Can you speak up or can you repeat what you said? So I'm not sure, Dr. Vickers, if you have anything you want to add.
No, that was great. I think the thing just to keep in mind is that hearing and attention really go hand in hand, especially when we're thinking about things like conversations or any of those social activities. So if you're having trouble with hearing, that's something that, it just as Jasmine said, letting people know, making sure that you're compensating for it how you can, whether that's wearing hearing aids or making sure you're in a quiet space can really help you engage in those types of activities. So really, really good question.
And I can't tell you how often we have folks that are a part of our program or associated with our program who do have those hearing difficulties, who do not wear their hearing aids. So I encourage all of you, wear your hearing aids, especially for those social events. If you have the access to having hearing aids, wear them for the events. Maybe you don't want to wear them all the time around the house. But we've also seen that hearing aids have come so far in technology. You can Bluetooth your hearing aids to your iPad and to your iPhone and things like that. So if it's something that you have been putting off, maybe reconsider making that appointment to even upgrade your hearing aids and things like that. We do see this more often than you might imagine at CEP. I love this next question that came into the Q&A. If a person has multiple layers of psychiatric problems, including depression, and people in the family maybe don't understand or want to spend time with them, how can a spouse help them to stay engaged? So this is coming from the perspective of a spouse when you may be dealing with some multiple layers of some behavior challenges. What are your recommendations on staying engaged socially?
Yeah. And do you mean with other family members, or do you mean like outside of like with the community members staying engaged?
Maybe both.
Um, yeah, that's a really good question. Um, Sometimes you just have to do the thing like you have to do, like I said. So I think it's really important also kind of educating the family a little bit who may not be around this person a lot to understand what the changes that they are experiencing, whether it's emotional changes or cognitive changes, that this is part of the journey that they're on with MCI, and just kind of teaching them a little bit about what their experience is like, and kind of hopefully building in that kind of compassion when maybe social interactions with them are not what it used to be, and that this is just going to be a change with that. I think it's also important, particularly those who have MCI, and I see this at CEP, it's really incredibly powerful to be with other people who are in the same experience as you are, because you don't want to have to always explain what MCI is and what you're going through. It's kind of nice just to be in an environment where people just get it. So I would encourage individuals, and hopefully some of those resources that I put at the end, like the Alzheimer's Association or NIA, I think, definitely the Alzheimer's Association Georgia chapter has a couple, where you can be in community with people who kind of understand your experience, and you can kind of talk about these things where it may be difficult to talk with family members about. And you're talking about these experiences, but you're also meeting new people, and maybe you get to learn a new skill, and you're doing activities. So you're kind of doing all the things that we encourage people to do.
Yeah, I cannot, so often people come into the program at CEP, and the most changing, beneficial thing that happens is to be around a group of other people who really understand. And you don't have to sort of put up some of the things around, given all those explanations, because, people get it. And so it can be a hugely a big change in someone's life to be around a group of people who also are experiencing those same challenges with early stage memory loss. One of our alumni put into the chat that his spouse went to an Aloha to Aging mixer. And there are so many of those that you can do through the Alzheimer's Association, through really connecting with these different groups. So I think that is such good advice, Jasmine, and really empowering your family with the information. Sometimes as a spouse, I think sometimes it means we just sometimes let things be uncomfortable or awkward and just kind of allow it to be what it is. Dr. Vickers, do you have anything you want to add to that?
I was going to add one thing because I think sometimes it's the case that it is kind of just, doing the hard thing. And then sometimes, people are really kind of we can get in a place where it's incredibly difficult to, even engage with the people that we love, even when we want to, especially if we have some of those cognitive difficulties. So what I would say is that if that doesn't feel like a possible step, right? If it doesn't feel like a possible step to, go to something like Aloha for Aging or something like that, it's okay if that social engagement bar isn't is a little bit lower. So that might mean doing an activity together. A lot of times, even if that engagement is not coming face to face, for example, speaking can be difficult sometimes for people with mild cognitive impairment. So finding something you can kind of do together in the same space, working toward a similar goal, like I'm thinking, making bracelets or something that you're doing with your hands that doesn't require you to have that conversation, can also sometimes be really helpful. It's simply having someone there. And if, the other thing to keep in mind too is that sometimes with some psychiatric components to MCI, it can be really helpful to have a structured activity, whether that's happening in the home or outside of the home. So it might be easier to engage in something like a club where you're doing the same kind of stuff each time, and there's not this burden to kind of keep a conversation going. So I highly, highly recommend, just like Jasmine was saying, trying some things out, but also don't feel like you have to do a mixer as the only social engagement. It's okay if that social engagement is simply sitting next to that person and doing something together.
Yeah, I want to highlight that too. Like, you don't have to jump to the big thing. Like, even just having conversation, even whether it's phone call or texting to a family member, just start with the small stuff if that's where you're at, and just kind of go from there. You don't have to do the big thing. This is a process, so just pace yourself, because I think when you um, do too much too quickly, it can cause a lot of frustration, and that's not what we want. We want this to be a pleasant experience, social interactions to be a pleasant experience for people.
That really kind of segues into the next question that came through in the chat. My family member with MCI hardly engages with us, and when he does, he's very combative. Me and my daughter really don't know what to do. What advice would you have for some, and I think a lot of homes experience this at a certain point. What advice do you have for somebody that maybe is having that combative or maybe even sometimes slightly aggressive experience with their loved one?
Yeah, I'd be curious what you hear. Well, I'll just give my 2 cents and then I'll. I think it's really important if someone's just not feeling their best, whether it's agitated or just to not push them. I think you don't want to escalate a situation to a point where it becomes even worse for both people involved. So if someone, that's kind of their way of saying, I don't want to be bothered, whether unfortunately they can't do it verbally. Maybe that's behaviorally, that's what they're communicating. And I think it's also important to kind of have a conversation about what do they want to do. So I think sometimes we get in situations where we have our own, as family members, we have our own idea about what someone should be doing or what we want them to do. And I think it's really important to bring it back to the person. What do you want to do? What's meaningful to you? Just to give them some agency and feel like they have a say, which they do, in what they want to interact and what they want to do.
The only thing I'll add to that, because that was a perfect answer, is I sometimes think of this, sometimes call this rolling with resistance. And keep in mind that that resistance may not be, it may just be the disease, right? It may be something that's kind of out of control, outside of the control of the person. I think, especially when we're talking about family members, it can be incredibly difficult to not kind of feel that very personally if someone is being combative or if someone is really pushing hard against us. But sometimes the best thing we can do is say, you know what, now is not the time. I'm going to walk away for a minute and we'll come back to this another time when the tension is a little bit lower. And that's perfectly fine to do. So don't push yourself to kind of keep it going and to get the thing done. Sometimes the best thing you can do is take a pause, come back to it at another time, and give yourself the grace to say, you know what, we didn't accomplish this goal today, and that's okay. We're going to do something else, and we're going to keep, the frustration low.
Any suggestions for a nursing home setting when we're talking about ways to engage with our family members who maybe don't want to get out of their room and things like that, especially if there is that layer of resistance or even, some of the terms we used in the chat earlier, like feeling that they're being combative. Can you speak a little bit just to that?
Yeah, I think the wonderful thing about nursing homes is that there's kind of a built-in community a little bit, and that there's my understanding from family members who've been in those types of situations is that there are always different activities for people to kind of get involved with. And then it's also you can be in a room with people, but maybe not necessarily interact with them. Like you're in the space, but you're not interacting with them. I think that's maybe building when we talk about building up to social interaction and social engagement, at least starting being in the room with people. You're doing your own thing, but you're in the room with people. And then you build to, oh, let's start having small talk with people. Okay, let's build to actually engaging in the activity with other people. So I think just taking those small steps with social engagement and can go a long way, just kind of building a little bit at a time with people.
And I think a couple of tips that I sometimes use for folks is, especially if someone is having a lot of trouble engaging socially, and the types of scenarios that Jasmine is talking about can be like bringing in a photo album and giving them a chance to kind of look through it and talk about it as much as they want to, and just kind of being present. Or other activities like that, maybe listening to music together where there's not this kind of forced conversation, but there is something you can bond over and let them lead that engagement.
It's such good advice. And I love what you highlighted about not taking things personally as this disease progresses, especially with our loved ones. It can be such a hard thing to not take things personally, but just remembering it's not the person, it's the progression of dementia or whatever your loved one is experiencing. So thank you both for really highlighting and unpacking those questions. And Jasmine, thank you for offering all of your expertise and all of the research that you've been putting together. We've got lots of people in the chat saying, thank you. This was so informative. This was so helpful. And there's lots of shout outs to you, Jasmine. So thank you so much for sharing what you've been working on for years and years and years and years with our audience here at CEP Live.
Thank you for having me.
And we'll be back next week, everybody. Be sure to join us next week. We're going to be getting into a workout with Ayatoni. The following week, we're going to be doing Tai Chi. And Jasmine mentioned self-compassion and compassion in elder care. And we're going to be talking about some ways to do self-compassion, and then how to extend compassion to other people in our lives with MCI the following week. So thank you all so much for attending. We'll post this on YouTube later today, and we'll see you all next week.